You're listening to The Mark Cox Show. Follow the show on Facebook. Facebook.com/The Mark Cox Show.
So pick a damn plan, since nobody knows for sure which one is ultimately going to be the best. Be unified. Then you've got a political case to make to the Democrats.
That is a Krauthammer there on Fox talking about the fact that he's getting a little frustrated with the inability of congressional Republicans to come up with a plan to replace Obamacare. I mean, they obviously have had a while to work on this. There are apparently still 5 or 6 different plans. People are a little sensitive when they get criticized about that. But I mean, there are some legitimate concerns. What we don't want to end up with is Obamacare light. My next guest is Dr. Elaina George. We have had her on the program before, and it's an honor to have her back. Dr. George, how are you?
I'm fine. Thank you so much for having me on.
Well, thank you so much. And I'll tell people that you've got your own website, drelainageorge.com. And I've always enjoyed your point of view on this Obamacare issue. What is your take on the seeming inability to come up with an alternative here?
I am frustrated as well. I think you've had 8 years to fix this, to come up with a plan. Get it together, because what's happening is creating this anxiety vacuum. It's allowing people who are proponents of Obamacare to paint horrible pictures about how everybody's going to be thrown off, and it's ginning up emotion when nobody thinks this is working well. And this is really an easy call here. You need to get rid of the mandate. You need to allow doctors and patients to come back to the forefront of patient care. You need to have transparency in pricing, and you need to have people control their pocketbook and buy what they want when they want it. That's really easy to do. If you really wanted to change it, it would have already been done.
So from a physician's point of view, there's been a lot of talk that if you simply repeal it and it's not replaced immediately, things are going to fall apart. And what's your point of view on that?
That's a fear tactic. There's something called the Emergency Medical Treatment Active Labor Act, EMTALA, which was passed in 1986. And anybody in your country, whether you're a citizen or not, if you have a medical emergency, you can walk into any emergency room and be cared for and stabilized regardless of your ability to pay. So there won't be people, lying dead on the street if Obamacare gets repealed. What I can tell you is that the people who it's supposed to help, the average working American, middle-class American, people working multiple jobs, it has not helped them because they can't afford to use it. It's like having a piece of plastic and not being able to afford it. So people are actually self-rationing. If you actually look at what's been going on, people are not going to the doctor. They're still going to the emergency room because they know they don't have to pay up front. So this is a complete scam. And those people who had it, who liked it, they're counting those same people who got kicked off their insurance and were forced onto Obamacare. Mm-hmm. It's actually only helped a fraction of people who weren't covered. And honestly, if people want to be honest about the whole problem, we would have been better served expanding Medicare and Medicaid up front for those people who couldn't afford insurance and been done with it. But it wasn't about that. It was about control.
Amen. Yeah, I couldn't agree with you more. I talked about that yesterday. Even if you take the 11 million figure they throw out as people who will lose their health insurance if we change this, what about the other 290 million people in the country? I mean,
exactly.
We threw out the baby with the bathwater, so to speak. I had also heard leading up to this that over the past couple of years, a lot of your fellow physicians had kind of gone away from taking insurance and went to more of a concierge type plan, which is, immediately probably going to put them off limits to people who are lower income to begin with. I mean, there's going to be a doctor shortage if we don't fix this problem.
Well, I want to correct that misconception. Everybody thinks that concierge is some out-of-control, pie-in-the-sky cost that people have to come up with just to see a physician. It's changed since the initial concierge wave of physicians.
Okay.
We're talking about now direct primary care practices where people pay $60 a month, $80 to $100 for a family to get complete coverage where you go to see that doctor is 4 or 5, in my office, it's 15 times a year for that flat fee, and everything that happens in that office is covered.
Wow.
That's a heck of a lot cheaper than paying a couple thousand and still having to carry insurance. Yeah. So I'm an ear, nose, and throat doctor. I'm a specialist. And if people go to my website, peachtreewellnesscoop.com, they can actually see my prices are listed up front. You can prepay. You know exactly what it's going to cost you to have the service. And there's no gray area. If hospitals had to do that, if doctors who are employees of hospitals had to put their offices on the same playing field, then patients can actually become consumers. And they have the power, and they'll actually force prices to drop because we'll have to compete equally. Right now, if you have insurance, you're actually paying more for health care than if you pay out of pocket. That's a scary, I mean, no one believes that, but it's absolutely true.
Well, I had somebody call in yesterday who described a $700 a month premium and a $6,000 deductible. Mm-hmm. So you've spent $12,000, $14,000 before you've gotten any coverage from your plan.
You're paying for the privilege to carry a piece of plastic around so you don't get dinged with being taxed and with a fine. That's really what it comes down to. And those who have health savings accounts are finding out the hard way that even when they and their doctor decide they want to have something done, get a lab, whatever, the insurance company actually has to approve it before the health savings account will pay for it. So that's someone controlling your money, your hard-earned money. I just take the opposite view, that if the patients actually could really control their money, they would actually be the best consumers. Right now you have the government trying to force behavior. They think, and they're right, that if you have to pay a lot, you won't use the service. Mm-hmm. And that's what they're using to say that it's costing less. It's not because it costs less, it's because people can't afford to use it. That's not health care.
Absolutely.
And I'm done with people trying to control us by emotions. Just take a step back and just be logical for a moment, and you realize the system is not working well. We just need to fix it. For real.
Yeah, you don't turn in every fender bender to your car insurance company. I think there's a lot of logic in that. That makes a lot of sense to me. Do you have hopes, as somebody who's studied this for a long time, that a year from now we're going to have this situation fixed or not? Are you worried?
You know what? I don't worry. I don't put my energy on that. I'm about solutions. And so what I've done as a physician is I've become a solution for patients who have large out-of-pocket payments, where a fraction of what it would cost them to pay with their insurance. They know what it is up front, and I'm changing my business model. I want to have a direct relationship with my patients. I want price transparency, and I think that I have seen a difference in the patients when they know what's going on. They become extremely empowered, and that's how we're going to get Congress to change this. It's not Congress. They have too much lobby money. They have too much of the status quo. Let's be honest about that, too. They're not working for us at this point. But when we withdraw our consent and we become the actual consumers that pick something else, they will come to the table at that point.
Sure. Dr. George, I've got about a minute left. Is there any way for people to find out if there are physicians in the St. Louis area that are doing what you do?
Absolutely. You can go to aapsonline.org. That's the American Association of Physicians and Surgeons. JoinTheWedge.com. That's a listing of all doctors across the country who are cash pay practice. You can go to my website, drelainageorge.com, and I have links to all of these so you can kind of look at it as a little bit of a clearinghouse.
Sure.
And ultimately, there's options out there. Direct primary care, we talked about medical cost sharing. I joined a group called Liberty Health Share as a patient, and I put my office staff on it. And we're paying $199 a month with $500 out of pocket, and we're covered up to $1 million per incident per year.
Wow.
And we are compliant with Obamacare. So there's lots of ways to play this if you just know what your choices are.
Dr. Elaina George, it's always a pleasure. Again, I'll direct people to drelainageorge.com to the website. Thank you so much for your time.
Thank you. Have a great day.
You too. Thank you very much. Boy, that's insightful. There are options out there, folks. Got to get to a quick break. We'll get to more of your phone calls after the top of the hour. 314-969-9797. We'll talk to John Henderson from The Range coming up.